Of Madison announces new proposed changes to the way Madison and police handle mental health calls, especially as they relate to race. Amy Reid joins us now to explain the possible changes. Amy?
This is coming a couple months after a black 17-year-old boy having a mental health crisis had an encounter with police in his own home. Many people said the police used excessive force, and that sparked an internal investigation into the officers. Now Mayor Rhodes-Conway is looking into ways to make sure this doesn't happen again. Video from early June shows Madison police officers using force to get a 17-year-old to comply with them. It's a moment that Brandi Grayson, who's working with the boy and his family, says has made his situation and his health worse.
The repercussions is not just on the physical to his body, but to his whole family.
She appreciates the mayor released steps to reform the way Madison police handle mental health calls, especially as it relates to race. But the steps, including involving black health practitioners and police training, appointing a longtime advocate to the Police and Fire Commission, and looking at reducing MPD's involvement in mental health calls, fall short to Grayson.
One, I would like to see her address racism and systemic racism and how it plays out with our police department and other institutions. Two, I would like for her to take a hard stance against racism. And three, I think I would like her to use her power and her privilege to make the police department do what they need to do.
Mayor Satya Rhodes-Conway says these are just first steps and they're subject to change.
What we're trying to look at the city as we realize that we have these crisis incidents that involve issues of mental health, we need to look at how we respond to them. And that it is possible that policing is not always the best tool or the best response if somebody is in mental health crisis.
In recent years, Madison police have instituted mental health officers whose goal is to help police with that very response. Rhodes-Conway says it's not enough and healthcare professionals should be the ones assisting on these calls. Police Chief Mike Koval said Rhodes-Conway's ideas are worthy of future review and collaboration. However, he has concerns. In a statement to us, I do have concerns about using a current/pending investigation as a mechanism, pointing to the urgency for change at MPD. As a reminder, MPD had initiated an investigation into this incident several days before the video/incident became public, and we have been very open and transparent as the process proceeds. Rhodes-Conway said these proposals are in early stages, and she's happy to hear feedback, especially as this conversation continues to form into actual policy.
We'll see where that conversation goes. Amy Reid reporting. Amy, thank you.